Welcome to Birth Words. This is episode number 61. And in today's episode, we'll be digging a little deeper on the idea of figured worlds, which we talked about in episode 59. So if you haven't yet listened to that episode, pause this one and go back to get a groundwork in what we're going to be talking about today.
Welcome to Birth Words. Words are powerful. What are you doing with yours? In this podcast, birth doula and applied linguistics scholar Sarah Pixton invites you to be intentional, reflective, and empowering with your language as we come together to honor those who give birth. The work of Birth Words is to elevate the language surrounding pregnancy, birth, and the postpartum period. Nothing in this podcast should be taken as medical advice.
All right, now that you've gone back and listened to episode 59 and know a little bit about figured worlds, we're going to dig in a little deeper today. And in episode 59, I read James Paul G's question about analyzing figured worlds when you think about what a figured world is, and especially when you look at a piece of text or a conversation and try to figure out what figured world is operating in that text or that conversation. And in that question, I'll read the whole thing and then I'll point a few things out. So he says, for any communication, ask what typical stories or figured worlds the words and phrases of the communication are assuming and inviting listeners to assume. What participants, activities, ways of interacting, forms of language, people, objects, environments, and institutions, as well as values, are in these figured worlds. So again, this figured world, this way of kind of assuming what the typical story is, includes many different factors, many different actors, and many different pieces. And he lists 9 things at the end of that question. And we're going to focus today on the first 3. So he says, what participants, activities, and ways of interacting are in these figured worlds. And as we think about participants, activities, and ways of interacting, I want to also point you towards a free PDF download that's available by going to birthwords.com. There's a pop-up that will be there if you're there for any amount of time where you can sign up to receive this free PDF. That is, the intended audience is for birth givers and their families. But if you are a birth professional, it's absolutely something that you can use with your clients, and feel free to print out and share as many copies as you'd like, or to share digitally this free PDF. And we're going to use the first couple of questions on this PDF to be reflective about figured worlds. So the PDF that I'm referring to is called 6 Questions for a Better Birth. And like I said, today we're going to focus on the first 2 of those questions listed on that PDF that are under the category of reflective. So these are some questions that invite you to be reflective as you experience pregnancy and to prepare to give birth. So the 2 questions are, what assumptions accompany the words I use, and what assumptions accompany the words I let in? And underneath the second question, what assumptions accompany the words I let in, there's a tip to take inventory of your pregnancy and birth bookshelf and e-resources. What do they take for granted? Really what this is asking are, what are the figured worlds, the typical stories that are assumed to be in operation for the words that you let in, the pregnancy and birth bookshelf that you read off of, the e-resources, the birth groups that you participate in on Facebook, or who you follow on Instagram. What words are you letting in, and what are they assuming? What do they take for granted? What do they think is typical? in the birth setting? And is that what you want to be your experience? If not, then I don't think it has any place being your figured world. So again, let's think about the mental creation that we do before we physically create, right? We can mentally prepare for and create an experience before we physically experience it. And so the 3 things that I said we're going to focus on today from this question about figured worlds is, what are the participants, activities, and ways of interacting that are assumed in this context, in this figured world? So when you read a pregnancy book, when you get on a birth forum on Facebook, when you are scrolling through your Instagram feed and you're following people who have things to say about pregnancy and birth, what are they assuming? Who are they assuming will be the participants in your pregnancy and birth? And why are they making those assumptions? Are they assuming that you will have a care provider who tells you what to do? Are they assuming you'll have a care provider who sees you as an equal decision maker in the process of preparing to give birth? Are they assuming that participants in that conversation, in that figured world, include supportive family and friends, supportive professionals, perhaps a doula there by your side to reassure you that you're doing exactly what you need to be doing? Are they assuming that you are an active participant in your birth and the preparation for it? What assumptions are being made about the typical story of pregnancy and birth and the participants in it? So the next is activities. What assumptions or figured worlds are being assumed about the activities that typically take place prior to giving birth and during giving birth? So let's think about doctor's appointments, right? Probably people are making the assumption that doctor's visits will happen. And maybe they assume that they'll be the typical 10 minutes with your care provider after you get your vitals checked by a nurse sort of setup. I think it's important, as we're being reflective about our figured worlds, to push back and ask why sometimes. Why is that the assumed way that things will be? Why is that the typical story, that you'll meet only for 10 minutes with a doctor during your prenatal visits? Why isn't it the assumed typical story that you'll meet for half an hour, 45 minutes to an hour with a care provider who cares for and supports you as a full person, wants to get to know you, not just physically what's going on with you and your baby and the numbers that they write on your chart, but also where your heart is and how you're feeling and how you're preparing physically and emotionally for parenting this baby that you're bringing into the world and giving you support through that whole process. So pause and think about the figured world that you operate in and the figured worlds that the words you're letting into your space assume, and about the participants and activities that are assumed to occur in that space. Another activity that comes to mind, especially when we get to the time of birth, is cervical checks. And I've talked a little bit about this on this podcast before and had guests talk a bit about it, but often this is one of those activities that is kind of assumed as part of the typical story of giving birth, that when you check into the hospital, the likely place where many people give birth, you'll have your cervix checked. And throughout your labor, when suggested or requested or stated by a nurse or a doctor, you'll have your cervix checked again and again. And this is one of those things that we can stop and pause and say, why? Why is this a typical activity, a typical story about what it looks like to give birth? And even in late pregnancy, these cervical checks, why is this a typical activity? Are they serving me and my baby and our health and safety, both physically and emotionally? Stop and think about that. Are they necessary? Are they helpful? Are they good? And you hear that I'm asking these as questions because I do believe that they serve purposes for different people in different circumstances, but I certainly don't believe they're serving anybody if an activity like a cervical exam or other common activities of pregnancy and birth, of which there are many more that I could name, but I'm using a cervical check as an example. This doesn't serve anyone if it's done simply because that's what's done, and it's done perhaps without consent, just as a statement of, okay, it's time to check your cervix. As a doula, I feel like this is one of my biggest jobs, is to step into that space and make sure that my client's okay with that. Just say, oh, great. Are you okay with that? How do you feel about that? To make sure their voice is being represented and that they're being heard. Because this, again, is an activity that's sometimes just assumed as part of the typical story, the figured world of what it means to give birth. And I think it's okay to stop and ask why and what is the purpose, and is this a good, right thing for my circumstances? The last one we're talking about today, the last little factor of figured worlds we're talking about today, is ways of interacting. What are the assumed ways of interacting with the people in your birth space? And again, we're thinking about the words that we're letting in during pregnancy as we prepare for that. The books that you're reading, the people you're following, the conversations you're having, what are they assuming is typical as a way of interacting during pregnancy, at appointments, out in public? Why is it assumed that it's typical and okay for random strangers to touch your belly or make comments about your size when that's totally not seen as acceptable and good and normal and the way things are outside of pregnancy and birth? I think it's okay to stop and pause and say, wait, why? Why do we do these things? And to respectfully ask those questions in those situations with whoever you may be interacting with, whether it's that person on the street, or your doctor saying, and now we're going to do this because you're 39 weeks or whatever, just saying, oh, can you tell me more about that? Why is that something that you recommend? And doing that research for yourself and finding out the whys. Why is this the typical way that pregnancy and birth happens? And if it doesn't feel right to you, then it doesn't have to be part of your story, whether or not it's typical, whether or not it's part of a common figured world. It doesn't have to be part of your story and your figured world if it's not something that you're comfortable with. So as we wrap up, I just want to remind you to be reflective about the assumptions that accompany the words you use and the assumptions that accompany the words you let in. What figured worlds or typical stories are they creating and telling? Who are the typical participants? What are the typical activities and ways of interacting? And are they serving the health of you and your baby as whole people? Or are they practices, activities, participants, ways of interacting that maybe we can change or leave behind? I hope you have a great week, and I look forward to being in touch. Follow me on social media at BirthWords on Instagram and Facebook, and follow all the resources there. I look forward to being in touch.
If you're interested in sharing your ideas or experiences on the podcast, go to birthwords.com. If you're liking what you hear, please leave a review on your podcast app. For more resources about language for a better birth, subscribe to the monthly newsletter at birthwords.com and follow BirthWords on Instagram and Facebook.